Hey, everybody. I always say that. I don't know why. Is there a lot of everybody's out there? Guess so.
Sure.
Anyways, whoever's watching.
We're always hopeful.
Right? We're getting more and more. Be with us and watch us because we're getting more and more. So, anyways, okay. This is our second episode of calcium that we're talking about. And today we're going to do more like calcium on the labels and does it really help us? Does it not? That kind of thing.
Right.
And so welcome. If you haven't met us, I am Dr. Smith and I do family medicine here in Lawrence, Kansas. And my clinic is Accomplished Health and Wellness. And this is Heather Fiore and she is a registered dietitian. And her clinic is Free State Nutrition, her business. And it's in my clinic. Hopefully we'll keep doing that. That makes it easier.
It works for me.
Yeah. Anyways, so today we're going to talk about calcium. So I thought that maybe we could start with like the supplements and how they're different.
Yeah.
So,
yeah, that was kind of the main thing we promised we would talk about today is the different kinds of supplements. Where do you get them?
Yeah.
Are they any good?
So, calcium, so like we're these little bitty heads again, and I am like trying to fix it and it's not really working, but you came on there. Okay, so calcium, so there's two different kinds of supplements, calcium carbonate and calcium citrate, right?
Although there's actually another one like when it's added to food like orange juice.
Oh yeah. Okay.
Calcium maltate,
okay.
Which I guess also still, absorbed pretty well. So
so the calcium carbonate is more commonly available and it's inexpensive, but it has to be taken with food because it depends on your stomach's acidic environment in order to be absorbed. Interesting, right? Calcium citrate, that can be taken with or without food, right? And so that one is more useful in people that have like absorption issues. So after bariatric surgery, that would be a little bit better. People that have achlorhydria, which isn't all that common, but this one is inflammatory bowel. Lots of people have inflammatory bowel, and that you have absorption issues with that. So.
Right.
So can you talk about elemental calcium? Like,
sure.
Or how do you like look at your label and know?
Right.
Because it's really the elemental calcium, right? And like the calcium carbonate is 40% by weight, and then calcium citrate is 21% by weight. But what does that mean when we're looking at the labels?
Well, so the good news is when you've got your calcium supplement and you're looking on the label, it tells you how much elemental calcium. So you don't have to remember this 40%, 20%.
Oh, okay.
You don't have to do the math.
Okay, great.
The math is done. And
it's all for us.
Yeah.
I'm all about the easy button.
Yes, for certain. So it'll say however many milligrams elemental calcium. And the same is true for your food labels.
Oh, okay.
It will tell you an elemental calcium, except it's not usually in milligrams. It's in percent.
Yeah, what does that mean?
So it's the percent of the RDA, which is 1,000 milligrams for adults. So that's what they compare it to. That's what they use as your 100%.
And RDA is recommended daily allowance.
Yeah. So the goal is 1,000 milligrams of elemental calcium, and then the food will say something like 10% or 20% or 30, whatever. And because it's 1,000, it's nice and easy math to figure out.
Yep.
So
what do we do if it doesn't match up? We just go with like whatever it says.
Yeah, that's
20% of my. Maybe they're using different numbers.
I'm very confused by that. Like it should match up. If it's going to give you milligrams,
right?
And it said it has 300 milligrams, it should be 30%.
Right.
Like that's how it should work.
It's easy.
But if it doesn't match up, or I don't know. I guess I would go with the milligrams. You figure. Maybe they did something wonky with the percentage, but the milligrams should be milligrams.
That should be it. Yeah. Okay.
Yeah.
And so your percent of your calcium absorbed depends on the total elemental calcium, right? Like that you get at one time.
Yes.
So if you're going up, like the more at one time. So say you had 1,000 milligrams, like, I don't know. Say you're taking Caltrate D. What is that? I think that's like, is that 600, 400? I think that's 600, 400. 600 of calcium and 400 of vitamin D.
Yeah,
I think
sure.
so.
Sounds
So, if you're taking that, are you absorbing all that calcium?
No.
I mean, you have the vitamin D there to help you, but are
Right.
you absorbing that?
So, I mean, what they say, right, is only like up to 500 milligrams is when you absorb the best.
So anything above that, though, is like just
I mean, you're just
extra.
Yeah, it's
But
just
you're
very,
not absorbing
It's
it.
very inefficient, right? You're just absorbing less and less of it above 500.
Right.
So it's wasteful.
So,
I think also potentially harmful, which I think we'll probably get to in terms of what's the
like
risk
the
of
whole daily.
calcium.
Yeah. Okay.
So 500, remember that, like if your doctor says you should take some calcium, or you decide I'm going to take some calcium, you can't take your all 100% of your RDA in one sitting.
Right. Yeah, you can't be taking 2 Caltrate Ds and hoping that that's good for the day.
Right.
It has to be spread out. I wonder why it's 600, 400. It should be like 500, 300 or something like that.
500, 800.
Yeah. Right? More vitamin D.
Yes. Well, should we talk about which supplements have calcium carbonate, which ones have calcium
Yeah, go
citrate,
ahead.
just to,
Yeah.
most
Yeah,
of
like
them.
Tums and Rolaids have calcium carbonate in it.
Yes.
And they're usually like 200 to 400 milligrams per pill.
Oh, is it that much?
Yeah. Of
That's a lot.
calcium.
Wow.
Yeah. Yeah, so, it's going to help your stomach, but if you're taking if you take 2 of the 200s,
Yeah, then
you're fine. If you take 2 of the 400s, it's going to help your stomach, but you're not going to absorb the extra calcium.
Yikes.
Yeah.
So, but also like, what's that other stuff? Caltrate and Oscal.
Yeah.
And then Viactive.
Oh yeah.
Those are
chews.
Those old chews.
The chocolate chews.
Those are calcium carbonate. And then calcium citrate is really just like Citrical. And I don't know, is that it?
I think
Yeah.
so. Citrical. Yeah.
And that one, like, how we're saying it's like 20%. That means you're probably gonna have to take more pills to get the same amount of calcium.
Right. But it'll say that on the label how
yeah.
much it is.
But I'm just saying, like, if you're not
yeah.
like wanting to swallow a whole bunch of pills.
Yeah. Well, I guess we're gonna probably put a damper on that later anyway.
Perhaps.
Yeah. So.
Yes, we will.
Spoiler alert. So I think we kind of touched on this last time that only like as an adult, your calcium absorption is lower. And so at any given point, it's like 30% of what you're taking in. But when you're little, like when you're a baby and an infant, a baby and an infant, same thing, hello. An infant and a child, when you're like developing those bones and growing and having all this stuff going on, your absorption is actually like 60% of what you take in. So it's really actually important for during those younger years that we're taking in the calcium because we're building the bones and we're setting like our foundation for what we have growing up. So, if you're, and we've you always say this about like juice, it's like 8 ounces, or 4. Yes, 4 ounces. 4 ounces of juice a day, not like 3 times a day.
Not with every meal.
But a day.
Yes.
It's a day. So, and then, 4 ounces of juice. So you should be doing more milk.
You got to drink something.
Or cheese. You can get from cheese.
Yogurt. Sure.
Yeah.
You can.
And then vitamin D is going to also increase your absorption, and that can be from your food or the sun. You don't have a lot of that lately.
That's a little tough to
It's
do.
just freezing. So if you see us chattering, it's because I had to turn the space heater off because it's loud. But even she came up and said, "I'm cold today."
I know. It's sad.
It's
sad to us. But even what I tell people is, even when the sun is shining in the winter, it's probably not strong enough. Right. First of all, you don't have your skin exposed.
We're not in the Caribbean.
No. And the sun isn't really
wish.
strong enough, even if your skin was exposed,
Right.
to make vitamin D in the winter.
Yeah.
Sorry
I wish
to
I
tell.
was in the Caribbean. But then I wouldn't get as much sun there either because I'd have my sunscreen on. So
Right. I know. Yep, just take your vitamin D.
right.
So is there anything else that helps absorb calcium besides vitamin D?
I don't know.
Yeah.
Not really.
Not really, just not going overboard with it at any one time.
Yeah. Well, yeah.
Right.
And but there's a lot of things that don't help you absorb it. Like
Okay.
your phytic acid and oxalic acid that you find in your foods, they can bind and inhibit your absorption. There's actually medications and stuff like that also, which we'll touch on.
Okay. Okay.
We can touch on that now, I guess.
And we
if you want
talked a
to.
little bit about sodium last week too. So
Yes.
right?
So medications that decrease your absorption, I think it's interesting. Bisphosphonates decrease the absorption of calcium. Isn't that interesting? Because they're like bisphosphonates are like Fosamax. They're your bone medicine.
Yeah.
But they decrease your absorption. Fluoroquinolones and tetracyclines. So that's like those are antibiotics, which actually are used quite frequently. Although I don't use fluoroquinolones as much, just because there's some nasty side effects with that one.
Okay.
And there's some more that just came out. The biggest one is Achilles tendon rupture with fluoroquinolones. Yeah, who wants that?
That's horrible.
And you know what? It's like our age group that does it. It's like,
really?
oh, that. Here's another one. This is great. Levothyroxine. But you know, thyroid medicine binds everything. So
you're supposed to take it on an empty stomach, right? They're just like, you know what? Don't eat anything.
You're supposed to take it on an empty stomach with water, and then you have to wait an hour before you can eat anything. Yeah. Phenytoin, which is dilantin. That's like, hey, Bethy. Hey, we haven't seen you in forever, Beth. Okay, back to our thing. Dilantin. So that's seizure medicine. And so that's going to decrease your absorption. And then there's this other one they really can't even say. It's Tylerodronate disodium. It's for Paget's disease, which that's not all that common either. So I don't even run into that. I don't even prescribe that. Let's just say it. You know, here's the thing with medicines. Remember one name, okay? If you have a medicine, remember the easier name.
Okay.
Because that's what we do. Who can say, like, how do they even come up with these names for medicines? I mean, what, as if it's hard enough to be a doctor, now you got to learn how to pronounce all the stinking medicines. Just remember the easy one. That's what I do, whether it's brand name or not brand name, whichever one's easier to come out your mouth, that's the one I remember. So who knows what the real name for that one is? They didn't say. Crazy. Okay, so back to medicines. Thiazide diuretics, so that's like hydrochlorothiazide or HCTZ, which that's easy to remember, HCTZ.
Yep.
That they interact with calcium carbonate and vitamin D. So and it will increase your risk of higher calcium in your urine and in your blood. Both places. You're spilling it everywhere.
Really?
Yeah, so you can get some hypercalcemia with diuretics. Also, aluminum and magnesium containing antacids will increase your urinary excretion of calcium. Calcium stones, people, nobody wants that. And then laxatives, mineral oil and stimulant laxatives, they're going to decrease calcium absorption because there's nothing in there to absorb, like it's pushing it all through. Right. And then prednisone.
Sure.
Yeah, so when you have bronchitis and you have like a lot of other stuff that you're constantly taking steroid for, that possibly you don't need the steroid for. You can kind of just get through, ride the wave and get through a little bit on your own. When you're taking that steroid, it is decreasing your calcium absorption, but it also actually decreases calcium in your bones. It depletes the calcium out of your bones and causes osteoporosis. It's not like that one time, but it's over time. So if you're using them a lot, and there are disease processes where you have to be on a steroid.
Right. I was going to say my grandmother had emphysema.
Yes.
So she was on prednisone all the time. She had like the moon face,
Yes.
And then she had osteoporosis after that.
Lupus, especially with lupus flares.
Right.
So you will go, there are disease processes that you are on steroids long term, especially COPD as well.
Yeah.
COPD, emphysema, you can have them. So emphysema is actually dead airspace in your lungs, whereas COPD is chronic obstructive pulmonary disease, which is usually actually inflammation in the bronchial tubes and everything. And so they're a little bit different, although we always think both of them with cigarette smoking.
Right.
But you can actually get COPD without cigarette smoking. You can get it from other reasons. So you will use steroids in both, especially as the disease progresses. But that's something that we already know that, okay, I'm going to put this person on long-term steroids and they're going to fracture their hip.
Yeah, I mean, you're weighing your risks and benefits. You want to breathe.
Yeah, you want to breathe.
And you can't breathe.
Or you want to if you're in a lupus flare, you that's terrible.
Right.
So yeah, you do want to do that. So anyways.
We did mention iron last week as something that can affect calcium absorption, but also zinc.
Oh yeah, zinc. And we're all taking that right now because everyone's sick.
Yeah.
So some other things, just to kind of talk about as we age, and we go over the menopausal hill, and now we're postmenopausal. We actually have increased bone reabsorption, and we also have decreased calcium absorption. So not only are we decreasing the calcium that we're taking in, that we're absorbing from what we're taking in, but we're also using it up that's in our bone. And so that just in general puts us at an increased risk, right? Because we don't have estrogen, because when your estrogen goes down, then your calcium absorption goes down and your bone reabsorption goes up.
Right.
It's crappy. So if you have something that creates that situation, then guess what? The same thing's going to happen.
Like what?
Like amenorrhea.
Oh.
So that's when you don't have your period at all.
You're not menopausal though.
Right. You're premenopausal.
Yeah.
But you don't have your period. And we see that with anorexia.
Yes. Yes, we do.
Yeah. And what will happen with anorexia is you decrease your calcium absorption, but you also will increase your calcium excretion in your urine. And so it's like a double whammy. And and usually the people that are anorexic, a lot of times the age group, do you ever see them? Yeah. So that age group is, what do you think? They're young.
Young, yeah. Teens and maybe early 20s.
Yeah. Early 20s is, what we see the biggest. And the sad thing is, if you can't get them onto a better relationship with food, then it goes into their later years.
Oh yeah, can go on for
or
decades.
they die.
Right.
From all the malnutrition. But that's happening during our most bone producing years.
Right.
It's like a double whammy.
Maybe a triple whammy.
Yeah. And then the athlete triad. So athlete triad is when you have disordered eating and you have amenorrhea and you have osteoporosis, and it's the same reason. You have a decreased estrogen, and so you're increasing your bone reabsorption and you're decreasing your calcium absorption.
Yeah.
Yeah. What about lactose intolerance? There were two, right?
Well,
unless they're getting it.
It depends how you handle your lactose intolerance.
Yeah.
There are ways.
Yeah. That's right. Because you can get it. You can. So, probably a lot of people that are lactose intolerant maybe are not lactose allergic.
Right. They're not like
they're like cow's milk. I mean, there are some
they're not
people
like
that
100%
right.
intolerant.
Yes. But there are some people that are cow's allergy.
Oh, yeah.
Cow milk allergy.
Right.
Sure.
That's different.
But
like if you're somewhat intolerant to lactose, you could still probably tolerate cheese. Yogurt might be tolerated because of the probiotics in there. And even milk within a meal might be all right. It's just like milk on an empty stomach might be too much.
What about if they did like a smaller amount throughout the day?
Right.
Spread throughout the day?
Right. Or like there's lactase pills, like, right? There's Lactaid.
Yeah.
That can work, or Lactaid milk.
What about vegetarians?
Well, vegetarians who drink milk obviously are fine. But vegans are definitely need to pay attention to their calcium intake because, like we said last week, you have to eat a lot of broccoli to get your calcium. A lot.
Like a lot, right?
Like every day.
Didn't you say like ridiculous. 5 cups or something?
I did. I sure enough. I said
That's
5 cups.
like, how many crowns is that? That's probably like, is it cooked?
No.
So it's raw, like raw broccoli.
Yeah.
5 cups.
Yeah.
That's probably like 3 crowns of broccoli a day.
Yeah.
That's crazy.
Yeah, you can't keep that up. Like
that's a lot of stir fry.
So soy milk. Yeah. Like, and then like tofu is sometimes prepared with what's it called? It's a calcium salt that they prepare it with.
Tofu?
Depends. It might have a calcium source in it.
Yeah.
You kind of have to look up the label.
Okay.
But I would recommend soy milk. If you're not going to eat any dairy, then a dairy substitute is the best way to get your calcium.
There you go. So I think last time we had kind of said this, that your bones peak at age 30.
30. I thought it was 25.
That's actually 30.
Exciting.
Isn't that exciting?
I mean, not for me.
Do you know what is
funny
is that we all think that age 40 is over the hill, but actually it's 30. It's actually 35.
Oh, for women, for sure.
Yeah. Isn't that sad?
It's ridiculous.
We've all been over the hill for a while.
Seriously.
Oh, well. So let's see. Oh, yeah. So when your calcium, like if you're not absorbing as much, you're still going to pull it from your bones because that's where our big store is. But I think last time we said that it's only like 1% of that calcium is actually used for everything else in our body. Yeah.
It's fascinating.
Did she say? I know, right?
I enjoyed your stir fry comment.
It is beef and broccoli. That's a lot of. I like that beef and broccoli, but
you know the vegans aren't eating that, right?
I know because it's got beef in it. They're just doing like the brown gravy on the broccoli, but that's like 3 bowls.
A ton.
Oh, holy. Yeah. Okay, so I did want to go over the U.S. Preventive Task Force recommendation on calcium and vitamin D because I found it interesting and kind of comical, actually.
Oh, great.
So there is adequate evidence to show that the daily supplementation, so supplements, of 400 international units of vitamin D and 1,000 milligrams of calcium has no effect on fracture risk in postmenopausal women. Anything less than that shows absolutely no benefit, and they aren't really sure about more.
Wow.
Yeah.
Is this in people who actually took the supplements like properly, or they took all 1,000 units at once?
I don't know. They didn't say that.
Okay. I'm just
my guess is it's probably like both, like in a 24-hour period.
Yeah.
Because they did say daily.
Right, but I'm just wondering,
is it once daily or 3 times daily?
Yeah.
Yeah.
Did they actually make sure that people were taking it properly, or they just lumped them all in together?
I don't know. My guess is they probably lumped both together.
They probably did.
But the thing is, they still didn't see a significant, like a,
Right. Not even a glimmer.
Yeah. Significant improvement. So.
So eat your calcium in
Eat your calcium.
food.
Yeah. So another one that I've been asked before is colon cancer and rectal cancer.
Mm-hmm.
So
Okay.
supplementation with calcium and vitamin D of 1,000 and 400.
Right.
So 1,000 milligrams of calcium and 400 international units of vitamin D daily
Mm-hmm.
may decrease adenomas in the colon, but more studies need to be shown.
Okay.
Need to be done. So there isn't something that says eat your calcium and you're not going to get cancer anymore. It's only certain adenomas too, and it's a maybe.
Wow.
So maybe it would be more beneficial to eat your fiber for that.
Right.
Right?
Probably. Yeah.
Prostate cancer. Now this is the interesting one.
Okay.
Prostate cancer. Because, we were talking about supplementation and you had said, what about higher doses?
Mm-hmm.
Right? So they looked
Yes.
at 1,500 milligrams per day
Mm-hmm.
or 2,000 milligrams per day.
Okay.
Okay. And these were observational studies, and this was calcium intake of that much. So it's higher doses of calcium. And what they found was that it may be linked to prostate cancer, and actually most linked to metastatic and aggressive prostate cancer and metastatic cancer. That kind of sucks. So the higher dose, and this is, I think, supplementation, not eating it.
Right.
Supplementation.
Yes.
So if you're taking that higher dose of calcium, you might be actually doing your prostate a disservice if you're a man.
Yikes.
Do you know when, this is, I know, random.
Tangent. Here we go.
She has to put up with these random thoughts in Jennifer's head.
Mm-hmm.
If you have a sex change and
All right.
you go from a man to a woman,
Mm-hmm.
guess what? You still have a prostate.
Oh,
Yeah.
I hadn't thought of that.
I know. I hadn't either until I came across it. And then I was like, oh, this takes me to a new level of having to think about things.
Yes,
Yeah.
the implications.
Oh my gosh.
It's complicated.
All right. So next one is cardiovascular disease. That's the other biggie, right?
Right.
Okay. So in 2016,
Yeah.
the American Society of Preventable Cardiology and the National Osteoporosis Foundation
Okay.
concluded that there is moderate quality evidence, so that means that the studies were okay, that calcium with or without vitamin D has no relationship, benefit or harm.
Okay.
Hold on one second. Are you looking for Next Gen Hearing? They moved back over to their spot, their old spot.
Really?
Yeah.
Does he know sign some other stuff? Okay, right?
Yep. Their old spot.
Okay, thank you.
Yeah.
Thank you.
Good luck.
Mhm.
Have a great day.
Thank you.
I got to love that. I should have loved it. Anyways, so that had no relationship, benefit or harm with the risk of cardiovascular disease,
Okay.
cerebrovascular disease, mortality, or all-cause mortality in general healthy adults.
Ooh.
Yeah, so calcium supplementation doesn't help your cardiovascular disease, and it doesn't prevent your stroke.
But does it harm?
Well, it might harm your prostate.
Might hurt your prostate, but not your cardiovascular
No.
health. Okay. Doesn't I thought I saw something
Doesn't-
about potentially, like if you get too much calcium, like above the 500, like does
Oh.
it like contribute to plaques in the arteries or something?
Oh, no, I haven't read.
No.
Do you know, I think that some studies say, there's like this, these studies say it's good, and these studies say it's bad, and these studies say maybe it's okay.
Yeah.
It's very confusing.
Definitely.
But I thought it was cool that they got together, both
Yes.
of them, and said like
Here's
it's
the
not
consensus.
beneficial.
Yeah. Okay.
Blood pressure.
Yes.
Okay, it does. So there's several studies that show that increased calcium intake will decrease your blood pressure.
Yes.
There's also several studies that show it doesn't. And so the data is probably inconclusive on that one.
Larg.
I know. But it might help.
It might help, but it also might help like in dairy products that also have potassium.
That's true.
Mm.
Yeah, because you're supposed to eat it. Preeclampsia. That's the other one. So it does help.
Okay.
It does seem to help in preeclampsia. And you have to do, this one's interesting because you have to supplement with 1,500 to 2,000 milligrams a day. And that may reduce your risk of preeclampsia, but that's only in the women that have low calcium intake already.
Okay.
But, you know, we're talking about those higher ranges, but actually your range is higher
When you're pregnant
when you're pregnant
anyway.
anyway.
It's not
So
that
that
much
makes
higher.
sense. Yeah. And you're supposed to take this from 20 weeks on, and it actually has to be divided in at least 3 doses.
Right.
And that makes sense
That
because
makes
you
sense.
have to absorb it. Yeah.
So this is to prevent, this is not like treatment of preeclampsia. This is
No.
preventing preeclampsia.
Trying to prevent it.
Yeah.
So it may reduce your risk by 55% in those women that have high risk for preeclampsia, and which are usually like first-time moms, or it can also be a mom who's had a baby before. So first-time moms, preeclampsia before, or moms who have had a baby before but now they're having a baby with a different dad. Yeah.
Okay.
Isn't that interesting?
Yeah, a little bit.
Yeah. So what are those men doing to us?
It's their fault, obviously.
Obviously. Finally, something to blame them on. That's just
Seriously.
I mean, the pregnancy is like half their fault anyway.
Or
Hello.
whatever.
Right? They talk us into it. Okay, we digress.
Totally.
Kidney stones.
Just thinking about your grandmother. I know.
Kidney stones.
Yeah.
So kidney stones, most of them are calcium oxalate. And supplementing with calcium. So here's the interesting thing.
Yeah.
When you have kidney stones, we tell you to increase your calcium.
Yes. From food.
From food. Yes, from food. Because if you do supplements and you're doing calcium and vitamin D, you actually will increase your risk of forming stones. So it's something in the supplement. But if you get it with the food, then you don't increase your risk of calcium stones, and actually it could be prevented. So it's so interesting. It has to come from food.
That's really all we're saying in
Yeah.
this whole 1 hour we've talked about calcium so far.
And the
Just
last
get
one
food.
is weight loss.
Oh, yeah.
There's
What
not
is
a
it?
link. Okay. It doesn't.
We thought so for a minute, but that was like
It's like
15 years ago.
Yeah, it doesn't. So now we've debunked them all.
Yeah.
So now you know, you're in the know. Eat your calcium.
Yes.
Better to eat it versus taking supplements, because supplements, there's something in them that is not necessarily probably all good for us. So it should come from your food. Can you just remind us real quick, like the foods?
The foods.
Yeah. What foods do we eat?
Dairy, number 1. Okay. Dairy, and then dairy substitutes, because they're usually fortified to match the dairy. And then you've got like
full fat dairy, right?
Full fat is good for other reasons. Right. Full fat can help you with your diabetes and
Yeah, because the light stuff kind of puts some weird stuff in.
Well, it depends what it is. Like milk, they just take the fat out.
Right. I was meaning sour cream.
Sour cream. Yeah, right. I mean, you do need to
Cheese.
watch sometimes when you go with something that's light.
Yeah.
Like whatever, it's going to have added stuff that you may not want.
Yeah.
Then there's fortified things like orange juice. If you decided to risk it and drink 8 ounces instead of what you're supposed to have as 4 ounces, at least then you get the equivalent of a cup of milk. Okay. So that's, it might be worth doing, depending on who you are.
In moderation, right?
In moderation. That's right.
Maybe not every day.
And then there's like the vegetables we talked about, but, really it's about volume there. So like, it's something like 21 milligrams in a half a cup of broccoli. Okay, so that.
What about spinach?
No.
Is it like a mound of spinach? Like
it's a mound.
So big that
it's
I
a
gotta
lot.
jump in it.
Yeah, like it's a lot. I think kale, if I recall, a cup of cooked kale, which is a lot, right? Because it's, it gets cooked down, is like 100. So that's still only 10%. of your day. All right. So that's
Wow.
about. So then we have the we're not going to go off on a tangent about it,
No.
but your canned fish with bones.
Oh yeah, the bones.
Yeah. So like sardines or even canned salmon.
I always think of Garfield when I think of sardines.
Now you can think of my mom because she loves them.
I will think of her now. I'm gonna think of her chomping on the bones.
Chomping. They're not crunchy. I don't know, but I don't think they're crunchy. They're
I don't
canned,
wanna
so
know.
no, it's fine. But if you're into that kind of thing, you're gonna get your calcium.
So the next time that you eat your salmon and you have a bone in it, just chomp away. Just like make sure that you chomp it all the
I
way
know, don't
up,
choke though. Yeah,
because we don't want you to choke, and we don't want it to get stuck in your colon somewhere either.
right. It really works best with canned. I'm just gonna say
Because they're probably
canned,
soft.
because they're soft.
Okay.
Yes.
I hate those crunchy things in my soft stuff.
That's it. And then I said tofu if
Yes.
it happens to be processed with calcium.
Okay.
Yeah.
Ice cream is on there.
I mean,
hello.
Dairy, duh. But again, like a half
Only
a
a small
cup,
amount.
which is a serving, is like 10% of your day. So
But if
That's
it's
a
the
lot of ice
last
cream.
10% that you need, eat your ice cream.
yeah,
One
sure.
cup. Just 1 cup. Half a
Enjoy
cup?
yourself. A half a cup is
Half
a
a,
serve.
half a cup.
Yeah.
That's all you get. All right, people.
Yeah.
We have really outdone ourselves with
We-
calcium.
Totally. We went over both times.
Yes, we did. We're trying to fix that. We're just not good at it because I tangent. It's all my fault. Anyways, magnesium.
Magnesium.
Is next. Magnesium is next on our list. Please remember that if you have a topic you want us to touch on, just shoot us a message on one of these. It's fine. And we will add it to our list so that we can cover it for you. And we will see you in a week. And hopefully we all survive the snowmageddon, unless you're in the Caribbean. Then I hope you survive the sun.
Wear your sunscreen.
You know what? You know what should happen is the milk people, they should start doing commercials where they're drinking milk in the Caribbean.
You think?
Then they're like vitamin D all over the place, and they're getting their calcium.
Maybe, but like then you just imagine it's hot and you're drinking
Yeah.
milk.
It's cold milk.
I
And it'll
know.
have like
I still don't want
the
it.
sweat on the side of the cup.
Yeah.
Yeah.
I don't know.
Watch this summer. That's what's gonna happen because somebody will upload it.
We'll see.
All right. Anyways,
Don't quit your day job.
we're gonna go, and you guys have a lovely rest of your day. Bye bye.